Hi, my name is Chris Gosselin. I'm the nurse manager at Mayo Clinic in Rochester, Minnesota.
I'm Debbie Bicks. I'm coordinator of patient navigation at Northside Hospital in Atlanta, Georgia. I manage the oncology navigation program.
I'm Lauren McKee. I also work at Northside Hospital in Atlanta, and I am the oncology patient resources specialist.
There's different categories of the metrics. It depends on what your organization is looking for and also what it is that you want to measure. There's 35 of them, but you could be looking at business outcomes or quality or what have you. So I think it's just important to know what you want to measure first and know what your organization wants to measure, and it's going to vary a little bit about from program to program depending on what your navigation program looks like.
Metrics can really guide not only your organization, but also your navigators to where the biggest impact is in supporting patients and how to support them best. We chose to use 23 different metrics to analyze how our navigators and patients are interacting in our system. Some of those metrics are date of diagnosis and open cases versus closed cases, length of navigation time, survivorship metrics, and referrals to palliative care.
In deciding what metrics you're going to choose the low-hanging fruit. Just start slow, start simple. Use the easiest things to collect and do those successfully.
We wanted to have a blend of what is important to our administration, to our organization, but also how do we benchmark against other organizations? What are other organizations doing? And so that's how we've been trying to apply it, just so we can see where our program is in comparison.
Yeah, and then, it's all about really telling the story of what is it that our navigators are doing. If you can't demonstrate what your navigators are doing, it means nothing about volume if you don't include, for example, the number of encounters you have with a patient, the time that the navigators are spending with a patient.
So some of the challenges we've had in analyzing or looking at metrics and utilizing metrics is the system that we created. We use an Epic-based system and navigation subtemplate. We have to match the language inside of Epic and IT language in order to make it nurse-specific and also healthcare-specific, and making sure that everybody is documenting the same way. For 6 months, we brought together our administrators and our nurse navigators so that everyone understood what we were documenting, where we were documenting it, and why we were documenting it, and how that would in return show up on metrics.
There's always that old adage, what you put in is what you get out. So if you put in something that's not accurate, then you're not going to get accurate results.
One of the tips or tricks that I would offer is reaching out to the AONN Metrics Committee, seeking an advisement, other similar programs, and the AONN Toolkit.
Using the Metrics Toolkit really helped us with the program, going back to the literature, reaching out to others in the Metrics Committee, getting wise counsel.
I think the best tip and trick that I can offer is connect with your IT department and become their friend. Treat them well and understand that they're going to have some learning curves in understanding healthcare words and phrases and how your navigators work.
Use what's out there, use your resources. There's plenty of people, there's plenty of things in literature.
Don't start too big. Don't bite off more than you can chew. So start off small and just make sure that you're doing that well first before you continue to grow.
There isn't a need to start from scratch. You can either find things in AONN literature, reach out to the metrics committee, you can work with your EMR colleagues and see what other people using the same EMR have already started using, and that way you have a good starting point.